Hi, everyone. Good morning. It's a pleasure to be here with you, Mayor Joyce Craig, and I'm here with Health Director Anna Thomas and Fire Chief Dan Goonan. And we're here today to talk to you about the homeless issue in Manchester, an issue that's affecting our state and our country overall. And it's an issue that we've been grappling with for many, many years here in the city of Manchester. But it's become an issue, a bigger issue now as a result of COVID-19. Where we've now seen visibly more camps, more people living outside as a result of COVID-19 and the CDC ruling. So what we wanted to do today is answer some of the questions that we've received. And as we're speaking live, if you have any questions for us, go ahead and type them in and we'll address them as they come. So I have a list of a few questions here and I thought I'd get started. The first question is, I feel like since COVID-19 happened, that there are a lot more homeless people around the city. Why is that? So I touched upon it a little bit when I first spoke, but I thought that Anna, you'd be able to address that.
Sure. Thank you, Mayor. I think what's really important is, Manchester has always had a certain level of homelessness and a population who have been unsheltered. So this pandemic obviously has completely exacerbated those conditions. And this was really a consequence of seeing a couple of cases turn up in the homeless shelter. And the shelter not being necessarily designed around the prevention of the spread of infectious disease. So we've worked very closely with them as a city department and some of the other city departments as well, including the fire department, to now socially distance where people are sleeping, where they're congregating, how they access the services and the building in general. And as a result of spending time trying to do that well, to plan for the future, many people chose to leave the shelter and set up encampments. So what has happened is it's become incredibly visual because people are out in these encampments, but ultimately we are trying to, through the CDC's guidelines and their recommendations, support the people while this was happening. But now we're in a very good place where we've kind of created the social distancing environment that we wanted to achieve that makes the sheltering environment safe. And we have a really concerted effort now. It's a united front between city departments and some of our key stakeholders to start to coach people out of these encampments and get them back into a sheltered environment. So this is a #1 priority for all of us right now, and it's something that is literally occurring right now on a daily basis. So we're hoping to remove, the supports from those encampments within the next few weeks.
Thank you. And I think what's important to note is that we did support the encampments with the assistance, and we're very grateful for the assistance from the state. And what we did was we provided porta toilets, portable hand washing stations, outreach from mental health workers, CMC, Fit New Horizons, and food delivery. And that was done to keep people in one place. Because according to the CDC guidelines, if we couldn't find shelter for individuals, which was unavailable, we exhausted everything we could, we needed to keep people in a place so that they were safe and our community at large was safe. And we did this knowing full well and communicating from the start that this was a temporary situation. And I appreciate you saying that, this is something that we will be working toward putting an end to. And now with the shelter being available and accepting new clients and having beds available, it's something we're working toward. The next question is for you, Chief Goonan. I've seen a big homeless encampment pop up in the North End. Why did the city pick this location?
Well, a lot of this stuff is happening in real time. Like Anna said, when we essentially lost the shelter due to a couple people who were positive over there, it caused many more people to be quarantined. And before we knew it, people were choosing to leave the shelter and go out into encampments. And essentially, we saw this really pop up in real time. So we had to kind of respond to this in real time. Nothing's ideal with this whole situation, and when you're sitting up in the EOC and you see what's happening, you got to act And based on guidance that we have, and that's really what it is guidance from CDC, it says that, keep people where they're at least during this time of COVID, and to try to do your best to do infection control and those types of measures to keep people a little bit safer and to not move people around the city. And I think to a great, the optics aren't great, we all know that, but for the most part, I think we're doing, it's doing what it was supposed to do, keep people, somewhere where we can, kind of work in the social distancing and stuff like that. Plus, what we're doing too, we're working with Fit New Horizons, and we're trying to develop a situation with the capacity to get people back in to a sheltered environment. So we've been working extremely hard with those organizations, and when you think about it, I mean, we're making these decisions, but those organizations are private organizations. We're trying to get funding for those organizations, trying to help them with social distancing. So what you're seeing is a shelter that had 140 people now down to 59 people because we just can't fit that many people in the times of COVID. So you're seeing kind of a flip-flop. So we had, let's say, in those encampments, we've always had an issue. We've always known we've had an issue out there, just being the city we are, like any other city our size. But now it's kind of reversed. So the people that were in the shelter, we're seeing them out there. And, the numbers that are in the shelter right now are smaller. So it's kind of flip-flopped. And it's something that we knew once we made the decision to keep people where they are, we were already planning for an exit plan. So that's what we're doing right now. We are, the fire department's in the encampments, every day, 8 hours a day. We've taken a census. We know where people are. We know where people are and try to message to get people back. So, yeah. So in the big picture, they've chosen these particular encampments, and we're supporting them for the time being. That's not, when we say we, that was an ask we had to the state, and the state are really great partners with this, and they understand. And in the big picture, this is kind of the perfect storm, because what we're seeing now, and we're seeing all over the state, is people that maybe were couch surfing are not doing that anymore. People are getting kicked out of those couch surfing locations, as well as all the, for the most part, the hotels were shut down all over the state. So even some of the small town chiefs that I deal with every day, they're saying, hey, wait, I didn't know I had a homeless population here, but I now it's all too real to me. And they're dealing with this all over the state. So it's a big problem throughout the state. And, we're the biggest city in the state, so it's a little bit more obvious here.
Yeah, and I think to your point, Chief, if there's a silver lining in any of this, it's that there has been attention brought to this. So, we've had our EOC open prior to COVID-19 to address homelessness and addiction. We've been dealing with this in the city of Manchester, and we know full well that there are not enough emergency shelter beds and supportive housing and affordable housing, quite frankly, throughout the entire state. And so with this, it has brought awareness to others in other communities that they also have this issue. And so I do feel like from a state perspective, there is more work now that's being done to address this than ever before. And we're fortunate that we now seem to have funding coming in to address this situation. So, I'm hopeful that with those funds, we'll be able to make some inroads to help individuals who are without a home. It's going to take time. But again, I feel like the conversations are being had now, and they hadn't been for the last few years. So I'm grateful for that. We've had a couple questions come in from folks watching. One is, what is the plan to house people this winter? Chief Goonan, you may be the best one to answer that. I'll just mention that, what we did this past winter was work closely with Fit New Horizons and with the faith-based community. Again, we found that there were not enough beds in the city of Manchester and throughout the state to house individuals who were looking for housing. And thankfully, Pastor John Rivera at Hope Tabernacle and others within the faith-based community really stepped up to help us house individuals during extremely cold weather. And one of the things that we've done through the time that COVID has been in place and also over the winter time is a group made up from the city and throughout the nonprofits have really done a great job reaching out to the homeless encampments and have documented where they are. So we've been able to do health checks on individuals, especially during those cold nights, because we want to make sure people are safe and healthy and staying alive and getting into shelter. I'm assuming we'll probably do something similar this winter, unless there are more beds that open up. But Chief, if you want to add anything.
Sure. One of the reasons why we knew this was going to happen, this year, the shelter, New Horizon shelter was up to about 160 people. They reduced their numbers, and rightfully so, to 138. So we knew going into this past season, that we were going to have a problem with that population, and getting an overflow shelter was very important. So you're right, Pastor John did step up. He provided the building, and we provided the beds and those types of things. We partnered with that agency. It's a great agency. So we developed a plan to handle the overflow. So some nights we had about 20 people in his facility, as well as New Horizons being full. So it may be much like the same this year, but in the big picture, we need to get people sheltered. This is we have to shut the faucet off at some point. We can't keep going the way we're going. So I'm hopeful with I think there's going to be an influx of monies now that we realize that was a major concern of ours going into COVID. It made it all too clear that we need help with the situation, and not just help here, but help all over the state. So it's a big problem, and it's been a problem here. I've been here for 36 years. It's been a problem here for 36 years. It's getting, it's getting more obvious, but yeah, we're going to probably deal with it the same way. But we're working on this. When we transitioned into COVID in the EOC, it was a pretty easy transition because we were already meeting every single week since the fall on homelessness.
Mm-hmm. Yeah, I think it's an interesting thing to talk about, and Anna, you often mention this, the percentage of people who are coming into the shelter who are actually not from Manchester. So data, it's always important to utilize data when we're making decisions. Do you want to talk a little bit about the information in terms
absolutely.
of people from
we know that the shelter had at least 30% of the people that were from outside of the city, and that's a hard number to really to figure out, because a lot of people are here. If you're here for 3 months, if you're here for 6 months, a lot of people are saying, I'm a Manchester resident, but 3 months ago I was living in Concord. I mean, it is what it is. I mean, I really think that in the big picture, we're obviously something needs to change throughout the state. I think the governor realizes that, and the Department of Health and Human Services realize that, and I think we really need a concerted effort from Concord and from Manchester and Nashua and all these places that we need a big effort to get people not just housed but help. I've been in the encampments often. I know this population well. There's a lot of mental health issues out there. A lot of people aren't even capable of being in homes themselves. So there's a lot of work to be done, no doubt. No doubt there's a lot of work to be done. But when we go out, and I was out yesterday for hours with our team. We have a COVID response team with Manchester Mental Health embedded with us. 8 hours a day we're out there talking to people and working with the outreach workers. And it's obvious once you get in there and once you see some backstories, there's a lot of work to do in the mental health field, a lot of work to do. So, there's going to be a population out there that's just going to choose to be out there until they can get that type of help. It's a big problem.
Yeah, and that's actually one of the questions that came in. What are the plans for the city or the state to expand mental health services for homeless or lower income individuals? And it's something, again, we've known all along has been, I'll say lacking, but it's just not been enough. There's been some mental health outreach, but not enough for the needs of the community. And fortunately, through this process where we've worked with the state, through your advocacy, we were able to increase hours and team members from Manchester Mental Health going out and working with these individuals, which is absolutely critical, as you said. So we know, and we've continued to advocate for it at the state level, that mental health counseling is critical in order to help these individuals right now.
Right. We were out for a few weeks now, and I know we've done at least probably 8 emergency hospitalizations for people that are in absolute crisis out there. I did one myself yesterday. You know, I know you've been out there today. It's truly an eye opener, and there's some big issues out there. And you know, in the big picture, these people aren't throwaway people. You know what I mean? They get some very big problems. So you know, when I hear and I see all the social media, but you know, there's a few people that are out there talking to people and getting their backstories and trying to figure out what to do with people. And yeah, it's going to take a lot of work, but there's a lot of problems out there that need to be dealt with in this population to get people out of their situations, certainly.
Yep. And then through this process, one of the things that we've also done is make sure that other communities understand the limitations in Manchester. And we've been proactive in terms of sending communication or doing outreach to ensure that communities are not sending individuals to Manchester thinking that we have all of the services available to help people. Anna, if you want to touch base on that a little bit.
Yeah, thanks, Mayor. You know, the one thing that this pandemic has done is certainly unearthed the reality that we do not have a statewide plan around homelessness. And what is concerning about that is, you know, we see this as a state of emergency, you know, and we had started conversations with our state partners back in the end of last summer, actually, about this, because here we had numerous people living unsheltered, and in any other context, so if there was a flood in the North Country, for example, and there were 100 people displaced and living unsheltered, we'd be calling FEMA and, you know, bringing in whatever supports we needed to support it in the spirit of a state of emergency. So we see this as these are individuals who, for one reason or another, you know, have led themselves to a point of crisis. And as a public health director, you know, my definition of health and the Institute of Medicine's definition of health is it's really a person's ability to function and thrive in the face of changing circumstances. So when we see people who are not functioning in society, they're not able to be productive members of society, to us, they are unhealthy, that there is a bigger picture and bigger drivers of determinants of health. And I think historically, when we've looked at this, for some reason, we've always disconnected the common denominator among all of us, which is mental, behavioral health, and well-being. And I think fundamentally, that's what's at the core. And then certainly all of the other constraints that exist, like not having enough supportive housing or low-income housing that's suitable to be able to support individuals to get them better on a path to becoming functional, to giving them structure and being purposeful. And I think we're at a place now where, you know, models that we've researched across the country, and we've had the luxury of being able to bring in some, you know, big name organizations that have had great success, whether they're from San Antonio, Texas, or from Dayton, Ohio, to basically model what has worked for them. And in those meetings, we've actually asked the other communities in the state of New Hampshire to be participants to that. So to invite the Concords in and the Nashuas and the other bigger cities. And we did so very intentionally because we knew that this was a shared responsibility. So at the end of the day, we are not going to be able to solely solve homelessness as a city alone, that this has to be a partnership between the state and the local community. And in fact, Chief Goonan, some of the numbers that when we started the EOC months and months ago around homelessness and addiction, I think we were looking at 50% of the individuals were reporting that they were from Manchester, and the remainder were either reporting from the rest of New Hampshire or even from out of state. So this is a statewide, even a regional problem that's playing out in the city of Manchester. And because we're a larger city with a plethora of resources compared to other areas of the state, this is where people end up migrating to. And, you know, we've never wanted to be a city that basically was a handout kind of environment. We're all about the hand up. So we want to see people working towards bettering themselves, to restoring themselves, to having a sense of purpose and thinking about something bigger than themselves. That's the definition of resilience. So we're at a juncture now where we've got to build people back up and get them plugged into the services they need. We need to be supportive to that. But this is all about the hand up. This should not be a handout sort of message. And again, I challenge the state to develop that plan with Manchester in mind. And how are we going to resolve this on behalf of all communities? Because we're not the only community that's grappling with a homeless issue. This is actually really bubbling up on the seacoast, and it's already been in place in Nashua, for example, or Keene, or even up in Berlin. You know, these are areas that are hard hit and may not have as much infrastructure as we do locally. So that also causes a lot of people to come this way. But this has to be about building out systems statewide in order for this to really be successful for the city of Manchester.
Thank you.
You make a good point, but just thinking, you know, you know, I see a lot, you know, people out there will think this is just a handout. This is infection control right now. This is going to end very soon. These encampments, the supported encampments, are going to be broken down and they're going to end. And right now, we are working on that plan to get people out. We're doing the messaging because we think it's going to be a lot easier to get, you know, we've got facilities now. We have a little bit more capacity. We worked with the diocese, the Catholic diocese, and 1269, an organization that just or is in the process of purchasing St. Casimir. That's now set up as a surge facility or help with social distancing, at least in the short term. They've been a great agency to work with, and they're helping us out immensely with that building. The building has 40 people now. It probably could be expanded a little bit more, at least in the short term, to give us a little bit of time to figure the next step out. But the immediate step is once these places are shut down and they're not being serviced anymore, everything's going to be picked up, and people are going to be expected to go into those facilities that are now clean and that are now socially distanced. They're supported there. There's food there. There's services there. That's where people should be. This is very, very short term, and we made these decisions just based on best practice out there and what we were in the guidance that we got from the state and the federal government. And you know, and myself and Chief Capano were out there for days looking at maybe a more appropriate location. Is there any other thing we can do? We know the optics aren't great out there, but you know, it was a lot easier to keep people where they're at. And like I said before, I think we've proven that for the most part, people are staying put. There's a police officer full-time 24/7. There's 2 other police officers that are in the neighborhoods in those areas that are supported. We haven't seen an uptick in crime. I haven't seen an uptick in you know, overdoses or in fact, our responses for this population is way down. Compared to when we were on Manchester Street. We were there 100 times a month. We're going there maybe a tenth of that now. So, you know, I don't know the you know, why that is, but obviously, you know, we're at least in the short term, we're doing what our plan was to do and keep people for the most part where they're at and support them there until the next step, and that's what we're working on now.
Right, with safety and health, you know,
Correct.
Forefront. One of the
Absolutely.
questions here, I think you just answered, but is, have there been any issues with crime associated with the current encampment?
We had I had an email from Chief Capano today. I talked to him almost every day about what they're seeing, what we're seeing. I know he hasn't seen an uptick in crime for the neighborhoods. We haven't seen an uptick in people who are, you know, theft or anything like that. We're just not seeing it. You know, like I said, I think a lot of this is led by what the optics look like, which, yep, it's short term. That's all I can say.
And none of us like it, you know, and these decisions are
No.
but again, they're made, you know, at a time of a public health emergency. to ensure the health and safety of our community at large, everybody in our community, as a temporary solution. CDC guidelines have changed. Our shelter is now taking new clients. They've worked with the health department and the fire department to ensure they're socially distancing the clients that are staying there, and we've been able to expand with 40 and potentially more beds over at St. Casimir. So I do think we're in a good place now for this transition, and appreciate all that the teams are doing right now to ensure that that happens. Let's see. One of the questions that we've received a lot is why has the city put up fencing around the encampments, and who provided the tents that these individuals are staying in? You want to take that, Chief Noonan?
Sure. It's basically it was just for safety, and it's all provided by the state of New Hampshire. We worked very close with the EOC at the state, with Assistant Commissioner Plummer has been really good to work with, and he's kind of our direct line to the man at the top to have these decisions made as quickly as possible, as well as Paul Parisi. Those folks have been instrumental in helping us with this. And when we asked them, or when we told them what we were dealing with, and when we realized, and when I say we realized, I mean for the most part, we realized people were in those big encampments, like I said, in real time. The people were in the shelter, and then they weren't there. And then they, kind of appeared. So when they appeared where they're going to appear, and when we reached out to the state, in consultation with the state and the CDC and our health director, we made that decision that it's better to keep people here. But they've been absolutely great in supporting these encampments. Everything is cleaned up. Probably spent upwards of $100,000 just cleaning everything, and they're going to come back after and do the same. So I'm very happy with the response we got from that organization, and hopefully at the end of this we can make some really I guess good decisions, best practice decisions. This is uncharted waters. I'm the fire chief here. I'm the emergency management director, but this is a crisis that we've never seen before. So once the after action report for this is complete, it'll be very interesting to see. God forbid this happens again, but we were really, as far as I'm concerned, we were as prepared as we could be for this situation. Not particularly for the for the homelessness, but in the big picture, we as an organization here in the city, and the health director and the police department and the mayor's office, we've drilled, and we have capacity, and we have equipment, and we were ahead of the game for much of this COVID response.
Right. And then regarding the tents, what we heard through this process.
Yeah. I heard the same thing. It's like, you're providing tents. We're not providing any tents. Some organizations out there are providing tents. Some churches are providing tents. Fit New Horizons was providing some tents. And much of those tents were bought. When the stimulus money came in, I can be quite honest with you, a lot of people spent their money on tents. When you go down there, those tents are in really good shape for the most part. They're they bought it with stimulus money and provided with other agencies, but not the state of New Hampshire, and not the city of Manchester for sure.
And one of the things that we've done in talking to the nonprofits throughout the city about this transition back into shelter, which obviously we want to make sure that those individuals who do want to be living in a sheltered environment can get into a sheltered environment, is it's important that we all work off the same page and the same goals. And so our nonprofits need to work with us, our faith-based groups need to work with us. And instead of potentially encouraging a behavior that we want to see an end to and hope for an end to for anybody, quite frankly, we all need to get on the same page and do everything we can to work on and for individuals to get them on a path to shelter, instead of providing them with options to continue to live outside. It leads into a question that was asked regarding panhandling and what's the guidance around panhandling. And right now, I think one thing that we saw during COVID, our downtown completely shut down for a few weeks. And during that time, when there was no one down here, there were no panhandlers, not one. And when we saw things start to open back up, we've seen a few panhandlers come back. And to me, it's a very obvious cause and effect. Individuals are panhandling in an area where they're confident they can make money or they can get food from individuals. And we have a very, very giving community. But the guidelines that I would stress and continue to stress, both with businesses downtown and across the city, and with our community and with visitors, is now more than ever, there are more supports for unsheltered individuals in the city of Manchester. And so if you want to give to someone to help them get off the street, then you should give to a nonprofit that is focused on doing that, instead of giving directly to an individual because you don't know where that money will go. And we don't want individuals living on the street, living on the sidewalk, living in the woods. We want to try to get them into a sheltered environment where we can provide them with services so they can get better. I would encourage, again, if anybody feels a need to give a couple dollars to someone who comes up to them and asks, or if someone's on the sidewalk with a box open asking for money, please refrain from doing that and instead give it to Fit New Horizons, to Waypoint, or one of the other organizations, many organizations in the city of Manchester who support this population. And I can say with confidence the funds will be used in a productive way to help them.
I can tell you, I know the people who are panhandling. I've spoken to many of the people who are panhandling. It amazes me that people are still giving people money out there that are on the street corners. There's a system out there. People are making money. That's the only reason why they're out there. And I can tell you, quite frankly, you're just feeding their drug habits. That's all you're doing. They're not using the money for rent. They're not using the money for those types of things. I know these people. They have a lot of issues. They have substance use disorder. They have alcoholism. They have mental health. But this is not helping. It's only hurting. I can tell you that right now. And when people are gathering on the sidewalks on Elm Street, and they point to us saying, hey, look, what are you going to do about this? You got to say, hey, look, if they weren't getting paid, they wouldn't be there. That's a fact. So it's very frustrating. It's very frustrating because, you know, it's what they do for work now, and they don't need to do that.
Yeah, and it's interesting, right, to when we talk about this, because not every panhandler is homeless, and not every homeless individual has a drug problem. But I think from a public perspective, it's all sort of lumped into one, but it's really important to delineate the two. As we have been in the city of Manchester, where we put plans together.
People are very, very good-hearted. I've seen people pick folks up, and I've physically stopped them because I know the backgrounds of people. They'll put them in their cars and take them to their next spot. It's amazing what I've seen over since I've been kind of helping with this situation, or at least trying to help with this situation and this population. It really is. The people are so good-hearted out there. They think they're doing the best for folks. They believe that they believe those signs. They believe that they just do, you know, I will work for food. I will work. It's not about that. You're fueling habits out there, and you're not helping. You should donate to agencies that are there to help people. They do great work, and it's very, very frustrating for me to see what's happening, because we see it all the time, and it's fueling things.
Thank you.
Yep.
And a question for you: has anyone made a fact-based, or I would say data-based, decision that shelter is better than a well-run camp? And if so, are there any facts that you can share?
Yeah, so I think what's tough about this is that, you know, the encampments are limited in the sense that we've been able to bring out some state supports, like porta potties, hand washing sinks, and then we're bringing out food and then we're bringing the outreach workers to the individuals. And I think one of the comments that someone made as I'm viewing them is that this is really about compassion. And I love that as a really important take-home message. At the end of the day, none of us want to see anybody living in a state of being unsheltered or not having what they need to live a good life. And I think the research shows that giving an individual a place of their own, and that's not a tent, that it's a housing unit with the supports that are needed, whether it's mental behavioral health practitioners or other practitioners coming in, caregivers, that is all about sort of housing first. That's the model. That's the evidence-based practice that we want to achieve. So not everybody wants to come in from the outside. There are clearly individuals out there that this is a personal choice, and they are completely at peace with that decision. And I think the outreach that we're all trying to do is really around trying to get the individuals that maybe ended up in these circumstances, don't want to be in those circumstances, want to be in a supportive housing environment. That's what we want to build towards. And we want to give people a place that they can call their home, and right now, for some, that's a personal choice, it's a tent. But for others, they need the structure around them just like the rest of us do. We don't have showers out in the encampments. We don't have, kitchens and other basic needs for people to just survive. And also have a place that they can have pride in. This is something that, they can call home and they can own for themselves, or, this is their own space. And I feel like we all have to have sort of that lens that ultimately everybody deserves that in life. They need to work towards it with us. This is not something that we're just going to do for them. This is going to be a partnership. But at the same time, I think it's the goal that we really want to see people sheltered in a safer place. And that's where the evidence lies, is that the more that you can do these wraparound services in sheltered environments, the more successful these individuals will be. And we live in New England, right? So the winter months can be really, really brutal on individuals who are choosing to live outside. And it's one of the reasons why during this winter, we mobilize fatality prevention teams to go out and do welfare checks on our homeless, because we've had instances where people have not survived the elements outdoors. They weren't equipped, they may have been struggling with addiction, whatever, and they're left out there to fend for themselves in the elements. So we don't want that for anybody. At the end of the day, we want to get people in safe places. That's the number one priority. But in the sort of the lens of a pandemic, we also need to make sure that it's safe for everyone, right? Because this is about mitigating the community spread. And as Chief Gooden said, it's about infection control and containment. So that's why the encampments, we're sort of allowed, and I hate to use that word, but we've supported the encampments for the purpose of infection control. We've now achieved that in the sheltered environment. So this is all about transitioning back to those places, which we feel is a safer place and a much more holistic place for individuals to be.
And I think it's interesting too, if these supported shelters weren't in place, there would be camps throughout the city. And when I was out, with the groups, they were saying, obviously it's much easier to have all of the camps in one place because they can service everybody. But it's not the norm, and it's not the permanent situation. So when people are in the shelter, they will have access to healthcare for the homeless in the downstairs, and have access to all of the services at the shelter, and hopefully be on a, have a caseworker working with them so that there's a plan in place for them to get out of the shelter and go into supportive housing, which will not happen if they're living outside.
It's you're absolutely right. It's so there's so much. I keep saying the mental health part of it. A lot of these people can't live on their own. They're not capable right now with their situations that they could live on their own. I mean, you can't build. You can't put. I was talking to Senator Hassan yesterday, and I told her you can't build $30 million worth of housing and expect people to function on their own. There's a lot of work that are going to have to go into some of these people with so much mental health and substance abuse and alcoholism and everything else that goes along with it to get folks reconnected. So it's a big issue, and it's always been there. I think if nothing else with this this COVID situation, I think we're realizing the extent of the issues out there throughout the state, and hopefully with the money coming in, we'll get together as really as a team from from Berlin to Nashua to have a comprehensive plan on how to help alleviate some of this. But I've been here long enough to remember when they closed down some of the supports they had in Concord. And I noticed a big difference since then. I mean, there's nowhere to send people anymore. When I say we did 8 or 9 or whatever involuntary hospitalizations out there since we've been doing the COVID response with our COVID response team, a lot of those folks are in and out because there's nowhere to send people. There's a waiting line to get into the state hospital that's days and days and days long. So there's big problems. I think we realize it, but we got to really start hammering down and shut the faucet off, or we'll be doing this until my 9-year-old twins are as old as me.
Well, I just want to thank you both for your time. We have one last question here. I know this is a problem without an easy answer, but I want to be a part of the solution. How can I help those who are unsheltered find stable housing? Anna, do you want to go ahead?
Yeah, this is such a loaded question because there are things that people can do. One of the first things that we're asking everyone to do if they want to contribute in some way is to go to Volunteer New Hampshire and register there first and foremost, because we have a partnership with them through the city and the mayor's office to then sort of have volunteers be kind of channeled through various needs that the city is facing. So that helps us organize it, because I've been asked this question a lot. I think, we are trying to get everybody to look at this as a whole community. And I think we, again, as much as I feel strongly that this is a state local partnership and a shared responsibility, I also think it's a shared responsibility among all of us. And I kind of go back to that sort of notion of compassion where, individuals who are struggling and are in crisis for one reason or another, that could be your sister, it could be your dad, it could be one of your children. There's no immunity to homelessness. And I think what's important is that we all share that responsibility to contribute in whatever way works for us. So first and foremost, as public health director, I have to say, I want everyone wearing masks when they're out in public. Please do that. Please do that wherever you are, especially when you cannot control social distancing, and wash your hands. So I have to get that off my chest. But then the other pieces, as far as your role in to play in this, we've already mentioned some of those things about, please do not contribute to the panhandlers, for example. If you're a business owner, I know we've got incredibly generous businesses. Please do not bring food out to homeless individuals. Instead, we want to promote the services that are available to them so they can get those wraparound, experts to help them to do the problem solving. I think as far as the housing crisis is concerned, we've had to work with whatever we have available. We've got a very active city welfare department. We have 211 and a great partnership with Granite United Way, and they have COVID-19 relief fund. So through the Emergency Operations Center, we are troubleshooting with families. So if they're about to be evicted or they need help with rent, we've already been able to work with them and submit applications through that mechanism to help offset the costs in the mode of an emergency. So there's lots of things that we could do sort of in a prevention intervention sort of way. The housing issue is really the biggest dilemma because we just do not have enough units available. So if you are out there and you're hearing this and you know property owners in the city, you know landlords, we want to see more of those players at the table to help us problem solve, because I'm not the expert in housing. I mean, I know it's something that we all need, but I'm not the person who's going to be able to like buy a property and, you know, provide those supports. I can help plan it, but certainly we need people who are the experts in the field. So this is really the blending of the expertise of housing experts and public health and mental behavioral health all coming together holistically to solve this problem. And that's how we've seen it work really well in other communities, that it really takes all of those stakeholders to be at the table. So that's really what we need now, is we need more leadership in those arenas.
Mm-hmm. And it's good that the conversations are being had,
Mm-hmm.
but it's important to say that it's going to take time, unfortunately. This isn't something that we can cure overnight. It's a very complex issue that we've been working on, as Chief Goonan said, for many, many years here in the city of Manchester. But I feel really good about the partners that are at the table. I am extremely grateful for both of you and all that you've done to address this homelessness issue, but many, many other issues in the city of Manchester. We're so fortunate to have you leading the city of Manchester. And I want to thank you for your time today and for all that you've done for the city.
Thank you, Mayor, for all that you're doing too.
Have a good day.
You too.
Thanks.
Thanks.